Hi everyone, I'm Kate from the Mayfair Weight Loss Clinic. Today I'm going to show you how to correctly use the Mounjaro pen in 5 easy steps. Mounjaro is a once-weekly injection which contains tirzepatide and is prescribed for weight loss. Each pack of Mounjaro contains a Mounjaro pen, a patient information leaflet, and an instruction leaflet. It's very important you read these before first use. Compatible needles will also be supplied. The Mounjaro pen contains 4 fixed doses, 1 dose taken weekly. This means 1 needle should be used each week. Important checks. Check the expiry date to ensure the medication is within date. Remove the pen cap to check the liquid. Mounjaro should be colourless to slightly yellow. It is important to note that the medication is contained here in the pen and not in the needles. Attach a new needle. Wipe the red inner seal of the pen with a swab. Pull off the paper tab, then push the capped needle straight onto the pen and twist the pen needle on until tight. Remember to always use a new needle every time you take the medication to help prevent infections and blocked needles. Priming the pen. Each time you use the pen, you will need to prime it to check that everything is functioning correctly. Pull off the outer needle shield and keep it to one side. This will be reused later when removing the needle. Pull off the inner needle shield and discard it. Slowly turn the dose dial until you hear 2 clicks and the extended line is shown in the dose window. This is the prime position. Hold your pen with the needle pointing up. Now push the dose dial until it stops. The 0 must be shown in the dose window. You should see a drop of liquid on the tip of the needle. If there is no liquid, then repeat the step. Selecting the dose. To select the dose, turn the dose dial until it stops and the 1 icon is shown in the dose window. The 1 icon represents a full dose. In this case, it is 5 milligrams. Injecting the medicine. Mounjaro can be injected into either the abdomen, the upper thigh, or the upper arm. Do change or mix up your injection sites each week to allow the skin to heal and avoid any potential soreness or bruising. Insert the needle at a 90-degree angle into the skin. Press and hold down the dose button, either with your finger or thumb, and the dose counter returns to 0. Then, count to 6 and remove the needle. You may see a drop of liquid at the end of the needle. This is totally normal and nothing to be concerned about. Remove the needle. Put the outer needle cap, which you saved earlier, back on the needle and unscrew it from the pen. Do not reuse the needle. Dispose of the needle in the sharps container. Once you start using the pen, you will notice that a plunger begins to appear. This is normal and indicates how much liquid is remaining. Once the plunger reaches the end, the pen is empty and you have used up all 4 doses. Put the cap back onto the pen and store it away until next use. The used pen can be either stored in the refrigerator between 2 to 8 degrees or unrefrigerated for up to 30 days, as long as the temperature does not go above 30 degrees Celsius. If kept unrefrigerated, the pens must be discarded after 30 days. And there you have it. That's how you take Mounjaro. If we can help you any further, please reach out to our dedicated team of advisors at the Mayfair Weight Loss Clinic.